Currently, Kozhikode district in Kerala is facing a new outbreak, and this outbreak is of Nipah virus, NiV virus. This virus was also seen there in 2018, again in the same district, which was just 10 kilometers from the current outbreak place. And the same doctor, Dr. Anup Kumar, who diagnosed the cases in 2018, could diagnose these cases. The importance of these cases is that there are unusual symptoms. There is a history of contact with the other person, and there is a clusterization. That means you see 3, 4, 5, 10 cases in a cluster. They get unusual symptom. Unusual symptom has some usual symptoms like fever, cough, sore throat, diarrhea, vomiting, upper respiratory tract involvement and lower respiratory tract involvement. In that you can get respiratory distress, breathlessness, and then apart from respiratory system, even central nervous system, that is brain, is also involved, and you can get encephalitis. Encephalitis is a brain involvement and inflammation of the brain or infection of the brain. But before that you get seizures, seizures coming in one or two or sometimes many, confusion, disorientedness, diplopia means you see double, and sometimes incoherent talk or speech, and the incubation period being only 4 to 14 days, and death rate or fatality rate is 14 to 75%. We have to be very careful. To be careful, we need to watch such kind of unusual symptoms and diagnose cases, but apart from that we need to prevent those infection people who can get infected. This is a zoonotic infection coming from animal to human being, like bats, particularly fruit bats and pigs, and then there are some flying horses, from there it can come. So we need to be careful of eating foods which are lying from a tree on the floor, where bats can also be there and they can infect. So we need to be careful about bodily fluids of bats and pigs where there is an infection going on, and also from those people which are infected. So medical community has to wear PPE kit. We have to have the same precaution what we have learned in the COVID period, that is SMS, social distancing, masking and use of sanitizers. By doing that we can prevent. Till today this kind of infections were seen from 1999 till today in only 4 or 5 countries: Malaysia, Singapore, Bangladesh, Philippines and India. It has never become epidemic or pandemic, but epidemic and pandemic can come from such kind of outbreaks only. So we need to be careful, we need to take all the precaution. National Institute of Virology is analyzing those samples, doing genome sequencing. There is no treatment available, there is no vaccine to prevent. The only treatment which has been tried and successful in the phase 1 is M102.4, which is a monoclonal antibody. They also tried remdesivir and cidofovir, but they are not successful.